There are many approaches to trauma therapy. Do you need to know them all for the social work licensing exam? Probably not, but give them a quick look, just in case. The first step in treating trauma is ensuring safety and stability. This might involve addressing immediate physical safety concerns, such as escaping an abusive environment and establishing a secure and supportive living situation. Then the therapy can begin. Trauma-focused cognitive behavioral therapy is one of the most widely recognized and effective treatments for trauma, especially for children and adolescents. Trauma-focused CBT focuses on helping clients process their traumatic experiences, manage their emotional and behavioral responses, and develop healthier coping strategies. Eye movement desensitization and reprocessing, EMDR, uses guided eye movements or other forms of bilateral stimulation to help individuals process and reprocess traumatic memories. It has been found to be effective in reducing the emotional charge associated with traumatic events. Prolonged exposure therapy is often used to treat PTSD. It involves gradually exposing the client to their trauma-related memories and situations in a safe and controlled manner, allowing them to process and reduce their anxiety and avoidance behaviors. Cognitive processing therapy is another evidence-based therapy for PTSD. CPT focuses on helping individuals challenge and reframe unhelpful beliefs and thought patterns related to their traumatic experiences. Dialectical behavior therapy is often used for individuals who have experienced trauma and struggle with emotion regulation and interpersonal relationships. DBT incorporates mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness skills to help individuals cope with the aftermath of trauma. Narrative exposure therapy is commonly used to treat complex trauma, especially in refugees and survivors of prolonged or repeated traumatic events. NET involves creating a chronological narrative of a client's life and traumas to help them process and integrate these experiences into their personal history. Mindfulness-based therapies, such as mindfulness-based stress reduction and mindfulness-based cognitive therapy, can help individuals with trauma by increasing awareness of their thoughts and feelings and teaching skills to stay present and manage distress. There's more than we can fit here. Group therapy can be enormously helpful, as can art and expressive therapies, music, dance. Many find relief through holistic approaches like yoga, acupuncture, and massage therapy, which can help regulate the nervous system and promote relaxation. More approaches to treating trauma, some including the use of psychoactive substances, some building on existing therapies, are being developed all the time. Stay tuned for social work licensing exam practice questions about trauma therapies and everything else on the social work licensing exam. Try socialworktestprep.com's full-length practice tests. You'll be glad you did. Best of luck.